We're talking about health now. We're going to kick off with new research this morning that has discovered weight loss injections. You know, we talk about this a lot, but apparently they could also help reduce alcohol cravings. Hilary's here. These weight loss injection things seem to be a kind of like cure-all, it would seem. What do you think?
Well, as you know, there's no miracle cure for anything.
No.
There never has been. But look, the first clinical trial of semaglutide, which the weight loss jabs that Ozempic and Wegovy include, in a small trial have shown that it suggests that it reduces alcohol consumption about 40% in people who have an alcohol use problem.
Okay.
So this was a study published in the Journal of the American Medical Association. People drank less, they had less desire to drink. And when you think that deaths from alcohol is at an all-time record high, this is of great interest.
Sure.
So already there's anecdotal evidence that those hundreds of thousands of people who are taking it for weight loss are drinking less. Maybe there is something here. And it certainly needs much bigger observational studies to see if it's true or not. You've got to remember that the study was done with 48 people in a laboratory.
Oh, right.
And, of course, behaviours change when people are being monitored and observed and offered drinks of their choice to drink for 2 hours. They might be thinking, well, I'm going to be judged if I have too much, so I won't drink so much. So all of those confounding factors have to be taken into account. So we don't yet know, but it adds the weight of people thinking, oh, my goodness, this is great. This has reduced heart attacks as well as weight loss. It's going to reduce the strokes. It could be good for dementia and Parkinson's. We mustn't get on that bandwagon just yet. We need to do more clinical trials. The other thing is, you know, alcoholism causes pancreatitis. So do the weight loss jabs in some people.
Really?
So you don't want to make that situation worse.
Right.
And would you treat somebody with an alcohol abuse problem who is slim and doesn't need to lose weight with a weight loss jab? Probably not.
And you're not really getting to the root of why they drink so much as well.
This might help to find out what goes on in the brain with these hormones, but we're not there yet. So caution.
You are going to, if it's telling your brain to eat less, it's logical that it would be telling your brain to drink less.
Yes.
You know, that's the thing. But I don't think we should get too excited.
No, we need caution.
More studies, because we don't know about the side effects further down the line as well.
That's right.
So, yeah, lots more work to be done. Now, look, you are very good at breaking taboos over the years.
We are.
And all of the years that I've known you. Something you really wanted to talk about, though, because it comes up quite a lot, but an awful lot of patients are a little bit wary about asking about sex after surgery. And I don't mean surgery on your bits, just after general surgery.
Absolutely. Well, one of the most common operations of all is hip surgery, hip and knee surgery, joint surgery. And one of the most common questions people ask is not, when can I drive again, which is usually 6 weeks, and following the physio's advice, but it's, when can I resume romance? You know, Valentine's Day tomorrow, when can I have sex again? So what you don't want to do after a hip operation, which is usually very successful, is to dislocate that new hip. So you don't want to be swinging from the chandeliers, that's for sure. You can resume sex usually within 4 to 6 weeks, provided it's healing nicely and you're given advice. Now, for the first time, you can download an online illustrated guide as to which positions are safer and satisfactory, less likely to cause problems with your new hip or your new knee or whatever. And because it's a question that's so often an embarrassing question and people won't ask the doctor or the physio, it's actually quite good to get that anonymously, download the information.
You can just do that.
And go from there. And it'll be on our website where you can get that.
Do you know what? That's a really good idea. And I mean, you talked about hip surgery, but it could be, you know, it's any sort of type of knee surgery.
Absolutely.
You know, as you're getting a wee bit older and all of that kind of thing.
I mean, if someone's had a heart attack and they don't need any further surgery, they're just recovering it from the medical point of view, then the advice usually is, rule of thumb, if you can do 2 flights of stairs without being too short of breath or getting chest pain, you're OK to have a bit of nookie. So that would be general. And, of course, cardiac rehabilitation is really good to give you the confidence to do these things. After a hysterectomy, after a normal birth, after a caesarean section, you want to make sure the scar's healed, the wound's healed. You want to make sure you're not bleeding still or you're not in any pain. And usually, again, after the 6-week checkup, you're probably OK to go. However, after childbirth, your hormones might not want to make you conducive to being in the mood. Your libido might be lower.
That makes sense.
As opposed to during pregnancy when it might be higher.
Yes, I know. Isn't that an odd thing that happens when you're pregnant?
It's all about hormone balance.
And also going through menopause as well. Your levels are all over the place and you might just not want to or not feel that you're... And there's that thing of not feeling as desirable as you did. Maybe.
Yeah. So we've been talking about sex after surgery, but actually the other way of looking at it is some people have got so much pain in their hips that it's stopping them having sex.
Or before they've had the op.
Before they've had the op. And some people say, I wish I'd had it done before because now I've got my life back, got my sex life back as well.
Yes, exactly. And it's important.
Yeah.
It is important.
Yes, it is.
And it's funny that we are still so reticent about it. I think it is quite a British thing. You know, I think other nations are much better at talking about it than we are.
Intimacy is important, you know, for happiness. And this is why it's called the Intimacy Guide. If you want to download it, go to our website and get it.
OK. And it's all there for you.
It's all there.
It's all there. It's all
Pictures,
sorted.
Pictures.
Not
of people, of drawings.
No, drawings.
Just drawing.
Just drawings. It's all very tasteful.
Very tasteful.
Very grown up. No sniggering at the back.
Absolutely.
Hilary, thank you very, very much. And have a lovely Valentine's Day.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?